Today, we are going to talk about Medicare Part D prescription drug plans. You will need to enroll in a Medicare Part D plan even if you don't take prescription drugs now. You should consider enrolling in Medicare Part D drug coverage when you are first eligible. If you decide not to enroll, you may be subject to a lifelong penalty. You need Medicare Part D for prescription drugs if you do not have a health plan that includes credible prescription drug coverage, like drug coverage from an employer or union, or you do not receive extra help, LIS, low income subsidy. You'll likely pay an LEP, late enrollment penalty, if you join a plan late. In order to get a Medicare Part D drug plan, you must have enrolled in Medicare Part A and B, and it must be active. You can enroll in a Medicare-approved plan that offers drug coverage. Here are your choices: enrollment through a standalone Part D plan or through a Medicare Advantage prescription drug plan. Medicare prescription drug plans help the consumer with the cost of prescription drugs. They are offered by private insurance companies. Here are some important facts about Medicare Part D. Drug coverage varies from plan to plan. Catastrophic coverage protects you from very high drug costs. Medicare drug plans may change annually. Each plan has a list of drugs that are covered. That list is called a formulary. Make sure your drugs are in the plan's formulary before you enroll in a plan. The formulary's list of drugs can change each year. Coverage is not automatic, and penalties may apply if you enroll late. What is the formulary? A formulary is a list of drugs covered by an insurance plan, and it can change annually. Think of the formulary as a dictionary that is alphabetically ordered from A to Z, only the formulary contains the names of medications. Each medication will be assigned a tier. In the listing next to the medication, you'll have a capital T, with a number ranging from 1 to 5. Tier 1 drugs are the lowest cost. Tier 5 drugs are the highest cost. Medicare Part D has a yearly coverage process. There are 4 stages to the yearly coverage process. The process is the same from year to year. Each year, beginning January 1st, the coverage process has a deductible that CMS allows private insurers to pass on to the consumer. This year, the deductible is $505. This is the deductible stage. If the plan has a deductible, all consumers must meet it before moving to the next stage in the process, which is called the initial coverage stage. In the initial coverage stage, Medicare sets aside a yearly dollar amount to offset the total retail cost of the medication. This is called TROOP, True Retail Out-of-Pocket Cost. Each Part D plan has a formulary and tiers, which determine the consumer's copay. The initial coverage stage is where consumers are paying a copay when they pick their medications up from their pharmacy. In our example, Sam goes to the pharmacy. The TROOP retail cost of his medicine is $1,000. In January, Sam paid the $505 deductible for 2023. Now in February, when he picks up his prescription, he will pay a $50 copay since he is in the initial coverage stage. How does this work? The retail cost of the medications is $1,000. The subsidy is $950, money set aside in the initial coverage stage, leaving him with a copay of $50. The subsidy is subtracted from the $4,660 each time he refills a prescription with a retail amount of $1,000. However, $1,000 goes into $4,660 almost 5 times. When Sam returns to the pharmacy in June, he has reached the end of his initial coverage stage, and his bank is at $0. He is out of subsidy. He moves to the next stage in the process. Now the pharmacist tells him that he has a $250 copay. Sam is not happy. Sam has moved to the next stage in the Part D process, called the coverage gap, which some of you know as the donut hole. In the donut hole, or the coverage gap, the consumer pays 25% of the retail cost of their medications. Now, what happens with the retail sum of $1,000? Sam pays $250 each month until his troop reaches $7,400. This will take 7.5 months. There are not 7.5 months left in this calendar year. Sam will remain in the coverage gap until the end of the calendar year on December 31st. Then, on January 1st of the next calendar year, he will start over with a brand new deductible. Now let's say Sam has more medications than the $1,000 per month. And let's say Sam hits the coverage gap a few months earlier than June. Once he meets the $7,400 troop in the coverage gap, he will move to the final stage of the Part D process, which is called catastrophic coverage stage. In the current catastrophic coverage stage, the consumer pays 5% of the retail cost of their medications, or $10.35 for a brand name drug, or $4.15 for a generic drug, which is greater. If Sam is in the catastrophic coverage stage on December 31st of this calendar year, then on January 1st, he starts the process over in the deductible stage. Medicare Part D drug plans follow this drug process regardless of being enrolled in a standalone Part D plan or a Medicare Advantage prescription drug plan. This process repeats annually, and only the dollar amounts change from year to year. Consumers ask, what causes me to reach the donut hole or coverage gap? Here's the answer. The troop of all your medications as you refill them monthly reduces the money available in the initial coverage stage. When the funds in the initial coverage stage are exhausted, the Medicare beneficiary moves to the coverage gap stage and so on. For each part of the Part D process, it is the troop costs of your medications you are currently prescribed that moves a Medicare beneficiary through each of the stages of the Part D process. To conclude, we urge everyone to enroll in a Medicare Part D plan when they are first eligible to avoid a late enrollment penalty. If you should incur a late enrollment penalty, it will stay with you for the remainder of your life and will be billed to you monthly in addition to your Medicare Part D premium. To receive additional help at no cost to you, please reach out to an agent at Madigan Insurance Group annually to receive your Medicare Part D plan. Call 847-457-1802. Thank you. We look forward to being of service to you. Madigan Insurance Group, Incorporated. Changing the insurance experience one client at a time.